All righty. So I am so excited to be able to talk about this today because it is World Urology Week. And I know you may be wondering, what is a physical therapist doing talking about UTIs? But this is something that I commonly see, especially when it comes to complaints related to pain. So I want to make sure that during World Urology Week that we take time to talk about UTIs because that is what this year's campaign is focused on. So if you do not know what a UTI is, you're in the right spot because we're going to learn about more things that you can do to try to help mitigate these symptoms, prevent UTIs, and also make sure you have a UTI prior to treating it because there are a lot of times where people are treating something that really is not present. So let's jump into it and let's talk a little bit about this. So first and foremost, a UTI is a urinary tract infection. Generally speaking, with a UTI, it's going to occur on the lower portion of the urinary tract, so impacting your bladder and your urethra. The urethra is pretty much a little tube that runs from the bladder, so that way your body can expel the urine. Now, what happens with these infections is that it is a bacterial based infection. So bacteria gets in this area and the bacteria begins to grow, it begins to increase in numbers, and that is what causes these symptoms. What symptoms? I'm talking about sometimes people have burning, they have pain with urination, they can have pain in the pelvic region and lower abdominal region, and also depending on severity, they can even have pain in the back. Now, a UTI can be more severe and impact the upper urinary system itself, including the kidneys. But the goal is to definitely prevent anything from getting to that point because that can lead to other issues. So you may be wondering what causes UTIs, and we're going to talk about that in just a bit. But before we talk about that, it's important that we know that UTIs are the most common bacterial infection that people get. So every year when people talk about different numbers, just know that UTIs are the most common bacterial infection. That's important because there are different things that we can do to help prevent them. But it's also important because we know that with it being so common, that it is possible for people to have a UTI, for the body to fight a UTI without medical intervention. Now, there are times when medicine is going to be needed, and your doctor can prescribe different types of antibiotics depending on the severity to try to help you combat the UTI. But most importantly, most of the time, antibiotics are not needed to treat a UTI. When we talk more about treatment and prevention, we'll go over some different things that you can do and also do some myth busting today because some people think what they're doing is helping and other people may not have any clue or idea what to do at all. So it's also important that as we talk about these things, unfortunate ladies, we are at higher risk for UTIs compared to men. Now, men do get UTIs, but I do want for my ladies to know that we are at higher risk, and that's simply because of the anatomy itself. So, with men having a longer urethra because of the penis, the bacteria has to travel a longer way. So, the chances of them having a UTI are much less, much lower than what women have the chance of getting a UTI. And when it comes to getting a UTI, there's certain things that can increase our risk for those. One thing I want you to know that can increase your risk is if you simply already have a compromised immune system. So if individuals already have diagnoses that may require additional treatment, such as radiation and chemo, then they can be at higher risk for UTIs because their immune system is already compromised. There are other things that can increase your risk, and other things that we can help mitigate and prevent, such as high blood sugar. So if you are having high blood sugars, you want to make sure you're talking with your provider so that way we can decrease your risk of type 2 diabetes and also decrease your risk of UTIs because your blood sugar is going to impact the biome itself within that region and also impact your body's ability to actually fight off bacteria that may be exposed. If you haven't heard, when it comes to hygiene, there's certain things that hygiene wise can increase someone's risk for having a UTI. So ladies, if you are using feminine washes, if you're also using different douching products, just know that that is putting you at a higher risk for a UTI and is not recommended. The vagina itself is a self-cleansing based structure, so it can actually begin to cleanse itself. Using a mild soap in the region is okay. Using water in the region is okay, but actually putting things within the vagina to try to clean things out is not recommended. And also, let me add this little tidbit in there. It is not meant to smell like florals and roses because those different things, all of those scents, all of those chemicals, and even dyes itself, they can change the pH balance within the vaginal region, impacting the vaginal biome. If you change the pH balance, that is going to increase your risk for UTIs. So all those things that you see on the shelf, whenever you go to the store in the feminine hygiene aisle, steer clear of them. They're not meant to help you prevent UTIs. They're actually not that helpful and healthy for your body. But if you do need a mild soap, there are different mild soap recommendations that we can give to help with you properly cleaning in that area. Now, as we get older, we're simply at risk for a higher risk for UTIs. As we age, different things occur within our body. Our immune system starts to decrease a bit. So when we get sick, when we have different wounds that occur, you notice that it takes longer to recover. It takes longer for those things to heal. And that also can impact our body fighting off the potential risk of infection. There are also some things that occur physiologically that can impact our risk for having UTIs as we get older. So as we age, we start losing elasticity within some of the connective tissue, including within the bladder as well. So the bladder itself is not going to be able to contract as well and also stretch as well, meaning that you may have some urine that your body previously could expel, but now it has more difficulty releasing and expelling that urine, indicating that you're having a higher chance of retaining urine. So that in itself can increase your risk of UTI. There's some studies that have come out which are amazing, and I'm happy to see that we are learning more about hormonal replacement therapy because, ladies, once again, we know that we have a higher risk of UTIs compared to our male counterparts, but during perimenopause and menopause, if you are getting frequent UTIs, the answer may be estrogen. So using a topical estrogen in the vaginal region can actually help to decrease the risk of UTIs because our estrogen levels do begin to drop. So keep that in mind, especially if you're someone who's frequently getting those UTIs and you're within that perimenopause and menopausal age. So perimenopause typically begins anywhere between 35 to 45, and most women transition through menopause within their 50s, okay? Now, for the men, you still have a risk of getting a UTI, okay? And that is something that you need to know because as you get older, you start noticing physiological changes as well, indicating that, hey, maybe you have to urinate more frequently. And one thing that can contribute to that is the prostate. The prostate naturally gets larger as you age. And if the prostate itself is enlarged and causing much more compression in that area, that can cause for some men to retain more urine, irritating the bladder, increasing that frequency and or urge saying they have to go, but then perpetuating the situation because now they are not able to actually release all of the urine. And if no one's ever told you, if you have to go pee, you need to go. Yes, there's some times where bladder training indicating we need to actually practice holding the sensation a little bit longer, but generally speaking, if you're holding your urine for long periods of time, so these are my teachers, my doctors, my clinicians, surgeons, those individuals, because we're constantly running back and forth. If you're holding your urine for a long period of time, you're going to increase your risk as far as having a UTI. Generally speaking, it's normal to have to urinate every 2 to 4 hours. The more fluid that you intake, the more frequently, of course, you will need to urinate. But even with that being said, people, whenever I say that, like, oh, great, I just won't drink water. Well, on the opposite end, if you're not drinking enough water, then your urine is going to be more concentrated, which can change the pH balance, which can impact your risk and increase your chances of having a UTI. So you want to make sure you're getting enough water. And the goal is to have your urine being like a light pale yellow. It should not have a strong odor. And a strong odor does not always indicate a UTI. Sometimes it's simply saying that you are dehydrated. So take a note as to the smell of the urine as well. So those are just some different things that can impact someone's risk as far as having a UTI. But now we have to talk about this because I'm always hearing people say different things like, oh, if you do this, it'll cure UTI, or if you do this, it'll prevent a UTI. And one very common thing that I see is people saying, oh, drink cranberry juice. Now, we don't really have a good amount of research to support that cranberry juice alone is actually going to be beneficial for helping you to cure a UTI. However, cranberries do have some properties that can help the bladder itself at the lining of preventing bacteria from building up. So there is some benefit to having cranberries, but the juice itself is not going to give you enough. Generally speaking, you need a much higher concentration. So talk with your provider to see if some type of cranberry-based supplement is going to be beneficial for you if you're someone who gets frequent UTIs. There's also some research that indicates that aloe can be very helpful as far as a supplement form as well with maintaining bladder health. But once again, before you add any supplements in, talk with your own medical team, talk with your provider, because just because you can buy it over the counter doesn't mean that it's something you want to add in immediately. Everything that we put into our body can interact with medications that we're already taking, or even just interact with our body's own chemistry. So before you add any supplements in, no matter who tells you this will be good for you, make sure you talk with your own medical team. Now, you already heard me say that douching and feminine products are not beneficial when it comes to preventing UTIs. We are recommending that women not douche and not use feminine products designed for this region when it comes to those that have like a smell or scent or color, or even now they put some like glitter in some of them. So you want to make sure that you're not exposing this area to unnecessary toxins, unnecessary chemicals. The vaginal region is self-cleansing, so simply using water and also a mild soap can be beneficial, but it is a self-cleansing area. It's up, so you don't need to add a bunch of harsh soaps or harsh chemicals. Now, some people will tell me that they know they have a UTI because they can tell by the odor that they're sensing whenever they go to urinate. And sometimes the foods that you eat, the things that you're drinking and or not drinking, especially if you're dehydrated, that can impact the odor itself or the smell of your urine. So simply what you're smelling does not mean that you have a UTI, okay? It does not mean that. You want to make sure that you are at least taking note as far as other symptoms that may go along with it before you self-diagnose yourself with a UTI, because it is important that we are getting the appropriate care and appropriate treatment. So other things that we need to know when it comes to this diagnosis of UTIs is that, hey, not everything that you see as far as a menstrual-based product is going to be beneficial. There's some menstrual products that can increase your risk of UTI. So if you're someone who's sensitive to using tampons, then you may want to consider other options, even rather than the traditional tampon, considering an organic option that has less chemicals in it, considering using a menstrual disc or menstrual cup, and also considering period panties or pads, because that for some women can help to decrease the risk of UTIs that they may have. So what do we need to know when it comes to intercourse and UTIs? Because I'm sure someone who's listening to this has heard that you want to make sure you urinate before and after to decrease your risk. And according to the studies that have been done, we're not really seeing that urinating afterward is having a significant impact as far as decreasing the risk of UTIs. However, you still do have a lot of providers who are recommending that you urinate within 30 minutes of having intercourse, so that way you can decrease that risk. And we're going to come back to that at the end where we start talking a little bit more about symptoms, because I want you to know I never want you to try to force yourself to pee if you don't have to pee. If anything, if you feel like you have a concern with UTIs, or you're noticing that you get more UTIs when you're having intercourse, you can also use simple wipes that are mild, water-based in that area. That way you can properly clean, and wiping from front to back. Making sure I emphasize that, wiping from front to back, because anytime you go from back to front, you are going to move any type of bacteria that is towards the anal region closer towards the vaginal region. And because of the location of penis in men, the chances of them doing this is much less, but it still can happen. Now, there are times where people will say, oh, if you're wearing tight clothing, that's going to give you a risk for UTI. And there is some truth to that in some cases. Now, if someone has a chronic history of UTIs and they're wearing tight clothing, then and they're noticing the UTI is not getting better, then yes, we'll typically tell them and advise that they wear looser based clothing, and also look at the material of clothing that they're wearing, something that's a bit more breathable. But more importantly, the UTI association when it comes to clothing tends to be more so when the clothing is soiled, meaning that it is wet. So if you're having incontinence, you want to make sure you find someone who can help you with that incontinence, looking for a pelvic floor physical therapist to help you be able to navigate that and mitigate those symptoms, so that way you can decrease just the soiling that occurs from the incontinence. Also, to go along with that, if you are someone who's working out a lot and may sweat more within the genital region, you want to make sure that you're properly cleaning afterwards and also changing your clothes, so that way you're not just having just the soiled items against the skin, which can be a breeding ground for different types of bacteria. So what exactly can we do? to decrease our risk when it comes to UTI. Well, you already heard me mention certain things when it comes to clothing, getting rid of soiled clothing, frequently changing the pad if you're using a menstrual pad, even switching from certain types of tampons you may be using to other tampon types that are more organic with less chemicals, or even those other menstrual-based products. But in addition to that, you also want to take a look at your diet. If you have a poor diet, then that is going to impact the overall gut biome, the biome within the urinary tract, your bladder, and also the vaginal region for our ladies. So if your gut health itself is poor, that's going to impact everything else within your system. So you want to make sure that you're getting plenty of fiber in your diet, making sure you're getting whole foods, not the processed foods, which also will help you mitigate and combat other things that can lead to inflammation, which can worsen UTI symptoms. Water is going to be so very important. There are some people who are more sensitive to caffeine, more sensitive to certain types of drinks, especially the sugary drinks and even carbonated drinks that can cause them to have irritation within their urinary system. And if you're someone who falls into that classification of sensitivity, then drinking those items may not be worth it, because for you, it may increase your risk of having a UTI. So we want to make sure that you are taking the time to drink enough, and also make sure you're drinking the proper things. So you'll hear different things go out as far as how much water should I drink. And some people will say 8 cups. Really don't have the research to support that, because water intake is going to be individual based. But a good rule of thumb is that you want to try to get around half your body weight in fluid ounces. If you're getting that, then you're generally getting around enough water for your body. But you also have to take in consideration as far as your environment. If you're in a very hot area, you'll probably need more water. Also, your activity level. The more active you are, you're going to need more water. Your body composition is also going to play a role. So the best thing you can do is, as you're consuming water, take a look at your urine. Is it that light pale yellow? If so, great. Also, your urine should not have that strong odor. So I actually had a patient tell me once their urine was the color of mellow yellow. That is too dark. Okay. We don't want your urine to be that color. So you want it to be a light pale yellow. And also with some people who may have different type of food sensitivities, back to that one, because I did not mention this, some people would notice with citric-based acids that impacts their bladder as well. So when you start having symptoms, take a note, take a diary, so that way you can get an idea as to what is going on. Is what I'm eating, what I'm doing, are those activities contributing to my symptoms? If so, that way you're able to address it and simply make those lifestyle changes, okay? Lifestyle changes. Now, there is one thing that I thought was very interesting, because I have seen this a couple of times and there actually is some research to support this. But when it comes to cyclists, meaning that those individuals who are spending a lot of time on bicycles, they're at higher risk for UTIs, and that can be because of the actual seat itself, with the pressure of the seat adding pressure in that perineal region. Also, because you're adding pressure there, it can decrease circulation to that area. It can also decrease lymph drainage in that area. And for some individuals, they can have some like numbness or tingling, which is a completely different situation. But because of that compression, they can be at higher risk for UTIs, especially if they're working out in hot environments, because now they have the soiled clothes within that region promoting bacterial growth. So just be mindful as to what you're wearing when you are cycling, when you're on the bike, and also be mindful as to other things that we mentioned when it comes to hygiene. Comes down to your diet, how much water you're consuming, so that way you can try to prevent your UTIs. And when it comes to treating UTIs, you heard me mention earlier that sometimes antibiotics are needed, but majority of the time, what we're seeing is that the body is able to combat this on its own. But if you're having those symptoms, what symptoms am I talking about? If you're having the burning, if you're noticing that you're having increased frequency of urinating, you're constantly having the urge to urinate, your urine has a cloudy base color to it. You may even notice like streaks of pink or red from blood in the urine. You're having pelvic pain. Those are reasons for you to seek out medical attention, so that way they can do a culture. Now, there are a lot of times when you go to a medical provider, you go to your physician and they'll say, oh, based upon your symptoms, you have a UTI. It is important that we just don't go based upon the symptoms, because there are lots of times that I've seen individuals who've been given antibiotics simply because of the symptoms, and the antibiotics are not fixing those symptoms because it is not a bacterial infection. It's not a UTI. So it's important that they're actually taking a time to do a culture. Generally speaking, when they're doing a culture, they'll do a urinalysis, so they'll do the test where you pee into a cup. With that, they'll take samples from it to see exactly what is present. Are they noticing any type of increase in the white blood cells? Are they noticing any type of certain enzymes that are present within the urine? And also, are they noticing higher levels of certain type of bacterial content? That can indicate whether or not you have a UTI. Also can be beneficial as well sometimes with fungal infections, although for fungal infections, they'll generally would also take a swab of the cervical discharge and or discharge within the penis itself. So being mindful that just because you have those symptoms does not mean that you have a UTI. So what exactly could that mean? And it's important that we think about this in different ways, because I've seen a lot of people who have all of those symptoms when it comes as far as like pain and urgency and the burning and the frequency. But when it comes back with the culture, there is negative. Your pelvic floor, unfortunately, if it is under stress, if it has a lot of tightness going on or other issues, then your pelvic floor can actually cause the mimicking of these symptoms and produce what seems like a UTI, but you're having all those symptoms, but it's not a UTI. And I've seen this a lot. So you'll have tightness within the pelvic floor that can cause pressure around that urethra. If you're having pressure through there, you may not be able to fully empty the bladder, which means that now you're probably going to have increased bladder retention, urinary retention, which for some people can cause spasms, especially depending on how much urine is being retained. You also can have tightness within the pelvic floor muscles that can cause pelvic pain and pain in the lower abdominal region. So simply having the pain, simply having frequency and burning, it's important that you seek out care so we can get the proper diagnosis. If it's a UTI, great. If you need to start antibiotics, we can go ahead and properly treat that. If you don't need antibiotics because the UTI is not severe enough for that, that's still a good thing, because now you know your body should be able to fight that off. But if it's not a UTI, you're having all those symptoms, now we know the answer, because now you can go find a pelvic floor therapist to try to help you mitigate that. And there's a diagnosis called interstitial cystitis, which impacts the bladder. And oftentimes these individuals will have significant pain and have symptoms that can mimic a UTI. So you want to make sure you're having the conversation. And now I want to go back to what I said earlier about urinating after intercourse. And I want to go back to that, especially after I just mentioned the importance of seeing a pelvic floor therapist if you're having these symptoms, because over the past few years, I've seen an increase of individuals who have been diagnosed with a UTI and they don't have a UTI, but they have pelvic floor dysfunction. And we started asking different questions, getting to the root of the issue. The reason why they were diagnosed with the UTI is because they correlated their symptoms with intercourse. My symptoms began, a couple of hours after engaging in intercourse. Well, their symptoms did begin then, but it wasn't because of bacteria. Instead, these individuals, their symptoms began because they were trying to force themselves to urinate after engaging in intercourse. And if you're trying to force your body to do something that it's not able to do, you can cause extra pressure, put more strain on these muscles, and that can lead to spasms and tightening within the pelvic floor muscles, which can reproduce the pain that you're experiencing. So next time after intercourse, if you decide, hey, I probably should go pee so that way I don't get a UTI. Remember, we don't have a lot of research to support that. And then also know you can use a wipe. If you don't have to urinate, don't force yourself. I don't want you trying to push on those muscles. If you do need to urinate, that's not a problem. But if you don't try to force it. Because when you force it, that's when we cause different issues that we don't want to happen. So what does this exactly mean? This means that in order to be properly diagnosed with a UTI, one, you need a culture. There are some individuals who will be developing UTIs more frequently. And at that point, we need for you to definitely see the provider so that way you can figure out what is the root cause, what is contributing to this. And then if an antibiotic is needed, then yes, the antibiotic at that point can be prescribed. But you want to make sure that before an antibiotic is prescribed, that you at least know that it truly is a bacterial-based infection, because you don't want to be treating something that's not there. Giving the body antibiotics can take a toll on your gut health. And antibiotics are necessary in preventing and also decreasing certain bacterial-based infections. However, because they can impact your gut health and it can take time for your gut health to recover, if you don't need it, let's not even go that route. So make sure you talk with your provider. When you go to your provider, you want to make sure they know the frequency in which you're having these symptoms. So keep a journal for yourself. Write down the journal, write down how often you're urinating. If you're able to, even write down how much you're urinating, because sometimes if you're not getting the bladder to release everything, that can indicate that we need more testing to determine how much urine your bladder is retaining. Now, there is a certain amount of void that should be present, but if it's higher than that amount, that can be a problem, and that can lead to different symptoms as well. So, what other tests can I do, especially if I don't want to go to the doctor? You can do some of the home tests, the accuracy on the home testing, where you actually use a dipstick. So, you pretty much would take a stick, you would urinate in a cup, or you sometimes some people do try to urinate directly on the stick, but it's best to urinate in a cup and then take that stick, dip it in the cup, and kind of like the litmus testing. So that way you can get an idea as to what is present. Now, if that at home test indicates that you have a positive test, I recommend that you contact your provider so that way you can set up the seat, figure out what the next steps are. They can retest you with lab-based tests, which will be more accurate, so that way we can determine the strain of bacteria and also properly treat the bacteria. Now, if you do the at-home test and at-home test is negative, that's when I advise, hey, let's continue to see the provider still and also seek out pelvic floor therapy, because there may be some other things going on with the pelvic floor muscles that we need to address. When it comes as far as preventing UTIs, the water, your food, those different things are going to be so very important. So making sure you're getting enough water in. When you do go to your provider, you also want to make sure that you are asking different questions as far as, are there certain medications that I can be taking or certain treatments that I'm undergoing that may be increasing my risk for developing a UTI? And also that can prevent my body from being able to combat a UTI, because those are things that you want to know prior to beginning any type of treatment. And specifically for my ladies, right now there's a lot of talk about perimenopause and menopause and hormone replacement therapy. As I mentioned before, we do have research showing that if you're having recurrent UTIs in the perimenopause and menopausal phase, that estrogen can be beneficial. So talk with your provider to see. A lot of the fear that was surrounding estrogen decades ago, that fear has been debunked since then. So we can make, so that way, if you need to utilize this treatment, if it's something that will help benefit you and also protect the health of the tissues, decreasing the risk of UTIs as well, then please take advantage of that. But talk with your provider to see if that's an option for you. So I hope this information was helpful. The goal was to just come on and let you all know that, one, UTIs are common. Two, there are different things that we can do to help decrease the risk of those occurring when it comes to our hygiene, when it comes to different products that we're using, maybe we shouldn't be using, when it comes to our diet, those different things. But also knowing that the risk of UTIs does increase as we age, but even with our age and different things that we can do to try to help manage. And if you're someone who's falling on the list as far as having urinary incontinence or urinary retention, I highly advise that you seek out pelvic floor therapy, so that way you can have your symptoms better addressed, and also that way you can get to the root cause of those issues. There are times when Kegels can be appropriate, especially when done properly, but there are other times where you need to learn how to properly relax the pelvic floor so that way your body can expel the urine itself.